explain now are the effects of traditional medical acne treatments. So I'm going to explain their positive and their negative effects and why they're still recommended, even though they generally don't work. So again, what I'm going to be uncovering here is what I call the good, the bad, and the ugly. So there are four main medical approaches that tend to be used for acne. Number one is antibiotics. Number two is combined contraceptives for females. Three, other hormone treatments. And finally, topical creams and cleansers. Now, antibiotics used for acne include erythromycin, tetracycline, doxycycline, and minocycline, amongst others. Now, whilst antibiotics can be effective in the short term, long-term use can be detrimental for your overall health. So if the antibiotics are effective, you still need to stop taking them long-term because it's not safe to continue using them long-term. In almost all cases, the acne will just bounce back once they're stopped. And quite often, it bounces back even worse. Now, if antibiotics are used long-term, as I did, as well as not always being effective, they often make the acne worse. And also, they can cause antibiotic resistance and damage the gut microbiome, and the gut microbiome is crucial to your health. Antibiotic resistance can cost you your life if antibiotics don't work when you need them to keep you alive after you are, in a serious accident, or if you've had surgery, as an example. As well as killing the Cutibacterium acnes, antibiotics also kill the commensal or beneficial bacteria that arguably play the most important role in our overall health. Almost all disease is linked with a dysbiosis, or what we would call poor microbiome balance. Antibiotics leave the door wide open to pathogenic bacteria and fungi, which may also cause acne and many other diseases. Studies have shown that those who use topical or oral antibiotics are 3 times as likely, for instance, to show an increase of bacteria in the throat and tonsils compared with non-users. Long-term use of antibiotics in acne treatment is also associated with an increase in upper respiratory infections and skin bacteria, and has been shown to affect blood sugar levels as well. We need to be aware of the potential consequences when we use antibiotics and carefully weigh the risks versus the benefits. So next I'm going to talk about the contraceptive pills, and they're given to women to reduce the level or effect of androgens, or male hormones, in the body. Though they tend to be effective in reducing acne whilst in use, the acne tends to worsen when the contraceptive is stopped. According to the UK's NHS website, as the National Health Service, taken over the long term, female contraceptives have been linked with the following: blood clots, including deep vein thrombosis, pulmonary embolisms, stroke, also heart attacks, high blood pressure, breast, cervical, endometrial, ovarian, bowel and liver cancers, osteoporosis, gallbladder disease, and also zinc deficiency. So, I would seriously question the risk versus benefit of using hormonal contraceptives in order to combat acne when you consider that the potential side effects are actually a lot worse than acne itself. But again, everyone needs to make their own decision on that. When we look at other hormone treatments, the one that's probably used, I guess maybe the most, is called isotretinoin, used to be called Accutane. And that's generally only given for severe acne or when all other medical avenues have been tried. Now, sadly, it's used quite regularly, as the other treatments are often ineffective in the long term. Isotretinoin works by unclogging pores, reducing the stickiness of keratinocytes inside the follicle. So the keratinocytes, they make keratin, which forms skin cells. It slows down sebum production, and it helps to shrink the sebaceous glands. Now, Isotretinoin can be effective, but the question is at what cost? Again, according to the UK's NHS website, the side effects include, and I'm quoting here, your skin may become very dry and sensitive to sunlight during treatment. Using lip balm and moisturizers will help. It's very important not to become pregnant whilst using isotretinoin capsules and for at least a month after stopping. This is because isotretinoin can harm an unborn baby. If you become depressed or think about harming yourself while taking isotretinoin, stop taking the medicine and tell your doctor straight away. That's an interesting one. I continue. Your skin may become more sensitive to sunlight. You may experience dry eyes. You may experience a dry throat. You may experience dry nose and nosebleeds. You may suffer from headaches and general aches and pains. You may experience anxiety, aggression, violence, changes in mood, or suicidal thoughts. These can be signs of depression and/or other mental health problems. You may feel severe pain in your stomach with or without diarrhea and feeling or being sick, which would normally include nausea or vomiting. These can be signs of a serious problem called pancreatitis. You may also have bloody diarrhea. This may be a sign of gastrointestinal bleeding. You may have a serious skin rash that peels or has blisters. The skin rash may come with eye infections, ulcers, fever, or headaches. You might find it difficult to move your arms or legs, have painful, swollen, or bruised areas of the body, or dark pee. These can be signs of muscle weakness. Your skin or the whites of your eyes might turn yellow. You might have difficulty peeing or feel very tired. These are signs of liver or kidney problems. You may have a bad headache that doesn't go away and makes you feel sick or be sick. There may be sudden changes in eyesight, including not seeing as well at night. Isotretinoin capsules can sometimes cause depression or make it worse, and can even make some people feel suicidal. So it's quite interesting when you look at isotretinoin. It's probably the most successful in terms of getting rid of your acne. But the question is, at what cost? You know, if you end up committing suicide or you have liver or kidney failure, was it really worth it? And also, a lot of the effects of isotretinoin are permanent. So when it says, you know, it helps prevent sebum being released from the sebaceous gland, well, your sebum is what moisturizes your skin. So you could end up with dry skin for the rest of your life. So you've gone from having one skin problem to another, but now the skin problem that you have now is irreversible. So again, you have to think really carefully before making a decision in terms of what route you want to go down. Another hormone often given to women is called spironolactone, and it's, you know, usually prescribed for high blood pressure, heart failure, and swelling, but also used to reduce acne symptoms in women. So it works by slowing the production of androgens, and common side effects of spironolactone for girls and women, according to the UK's NHS website, can include breast tenderness and/or breast enlargement, painful and/or irregular periods, as well as vaginal bleeding after menopause, hair loss, photosensitivity, which is sensitivity to UV rays from the sun and other light sources, nausea and vomiting, and drowsiness. So again, it may well help with your symptoms in the short term, but what happens if you stop taking it? Well, quite often your acne comes back and it comes back worse. Or if you keep taking it, now you've got an increased risk of those other issues. So again, you might have just swapped one issue for another one, and it might be another issue that's worse than your acne. So again, you just need to decide carefully which approach you would rather take. Colciprindiol is another hormone treatment prescribed for women, generally for severe acne that didn't respond to antibiotics. What it does, it helps to reduce the production of sebum, and the side effects of colciprindiol include bleeding and spotting between periods, headaches, sore breasts, mood changes, low libido, weight gain or weight loss, blood clots, and breast cancer. So again, you've got to really weigh up the risks versus the benefits before taking a product like this. And again, colciprindiol does not address the why of any hormone imbalance. It only attempts to mask the symptoms. So if we now look at topical treatment,